In today's health headlines, today is World Sickle Cell Day. Know the signs of sickle cell disease, what treatments are currently available, and how gene editing technology can change lives for those living with sickle cell disease. Joining me is Dr. Cece Calhoun, Yale Medicine hematologist, oncologist specializing in sickle cell disease and assistant professor at Yale School of Medicine. Welcome.
Thank you so much for having me, and happy World Sickle Cell Day.
All righty, we're going to learn a lot about it. What are the most common signs of sickle cell disease, and who is most at risk?
So in the United States, we're fortunate enough to have a newborn screening. So most babies born in the U.S., all babies born in the U.S. are tested for sickle cell disease. But if you aren't aware of whether or not you have sickle cell, sometimes children may have swelling of the hands or feet. That's what we call dactylitis. But the most common presenting sign and symptom of sickle cell disease is pain. That's why we mostly see patients in the hospital and why they're seen in the acute setting. It's unpredictable and it's very severe.
What treatments?
Thankfully.
Go ahead, I'm sorry.
Oh, no. I was just going to say our local Sickle Cell Disease Association of America Connecticut chapter is actually working on trait testing for sickle cell disease, which will allow people who may want to know their status to find out.
That's terrific. What treatments are currently available? I know we need to do more.
Yes, you're absolutely right. We have so much work to do. Many times we spend time treating the consequences of sickle cell disease like pain. But when we think about treatments that are available to treat actual sickle cell disease, they're less than a handful. We have medications that prevent the red blood cell, which is what sickle cell disease affects, from sickling. And those medications are oral medications you take every day, like hydroxyurea and Oxbryta. We also have medications that make those red blood cells less sticky that you can get in the hospital. But we also have treatments, and I think we'll get to talk about this a little bit, that prevent the body from actually making sickle cells, like bone marrow transplant and gene therapy.
All right, what about CRISPR technology? What is that?
Yeah. So CRISPR technology is a type of gene therapy that we've all been hearing about and we're quite excited about. We make all the cells in our blood and our bone marrow. When I ask people that, they're like, what? It's supposed to be hard. But no, that's our factory for all the cells in our blood. And the parent cells of all those cells are called stem cells. The really fancy name, if you want to be super fancy, is hematopoietic stem cell. But those are the cells that turn into our white blood cells, our red blood cells, and our platelets. What gene therapy does for persons who have sickle cell disease is using technology called CRISPR can say, ooh, we can identify the part in here that we want to activate to prevent those cells from sickling. And it uses technology to go into those genes and change it, allowing someone to be a cure for themselves. So it's really, really cool, very scientifically forward, and offers an opportunity for a potential cure for sickle cell, which is a big deal.
Yeah, that is a big deal. Dr. Cece Calhoun, thanks so much for your passion in this area.
Thanks for having me, and happy World Sickle Cell Day.
Take good care.